Welcome to PWS United, a podcast for the Prader-Willi syndrome community, brought to you by PWSA USA. This podcast gives the latest news in research, advocacy, and family support by bringing together staff, volunteers, PWS treatment specialists, biotech and pharmaceutical representatives, caregivers, family members, and individuals with PWS. Our goal is to share education, awareness, and resources with those living with PWS and their supporters. Join us in our mission to enhance the quality of life and empower those affected by Prader-Willi syndrome.
Anyway, okay, well, yes, we're here.
Deep breath to start. Everyone can take it. Everyone take a breath with us.
Collective deep breath. Carrie is about to leave for Europe for 2 weeks, and it's all going to be okay.
It is all going to be okay. It is. In hindsight, this is very poor planning on my part, even though for some reason I was the one person who the time frame for this trip didn't work perfectly among all the other people going. And Stacy, being the best boss person ever, was like, "It's fine." And it is fine.
It is totally
Everything's
fine.
done. I think it's just the anticipation of the what ifs before taking off. But again, I know that everything's going to go great. Put out in the universe. We took our deep breath. It's solidified.
Yes, it's going to be wonderful, and we all wish you safe travels and that you have an incredible time. And we're excited to see pictures. All right, well, before you leave, we do have to get through this pulse. This is volume 130 from September 5th, last Friday. And the header for this pulse is in recognition of Direct Support Professionals Week, which is this week, September 7th through the 13th. And yeah, we love our direct support professionals. And each year during this week, we pause to celebrate the incredible individuals who dedicate their careers to supporting people with disabilities. At PWSA USA, we know firsthand how essential these professionals are to the lives of children and adults living with PWS. They are the backbone of care. They ensure dignity, safety, independence, and opportunity for those they support. From carefully managing food security to navigating challenging behaviors to offering encouragement and joy in daily activities, DSPs make an extraordinary difference every single day. And we encourage you all during this week and any other week or day that you feel inspired, but especially during this week, we encourage families and communities to take a moment to recognize the DSPs in their lives. So you can write a little handwritten note, a kind word of gratitude, a small token of appreciation can make a lasting impact. Give them a gift card to a restaurant that they love, or send them flowers, or book them a massage that you paid for. Anything. Like there's a lot of ways that you can do that. So we definitely encourage you all to do that. Stacy, our CEO, wrote a really beautiful blog, and I'll link to that in the show notes. We also have a podcast episode from last year, episode 8, Direct Support Professionals Week panel discussion that came out last week. And we are going to have another episode coming out next week for
Yes.
I'm like, she's recording on Thursday. So like if all goes
all the
well,
timing works out.
if all the
next
timing
week,
works
yes.
out, it's coming out. But yeah, we just want to give a huge, huge, huge thank you to all of our direct support professionals, from all of us on staff, all of us parents, and everybody. Thank you all. You do incredible work. Our PWSA memory for this week is our logo, the evolution of PWSA's logo. And there's a graphic on our social media, which if you're connected there, you can see the different graphics that we have gone, or the different logos that we've gone through. I haven't seen that one, the square one at the top.
The first one?
Yeah. That's
Isn't
a
that
really
amazing. That was the first ever logo. It was created by a doctor as like a volunteer thing that he just did. So
it's really cool to see the different logos. And you wrote a really great blog on the story of how we evolved through these different logos. So we'll have a link to that in the show notes.
Yeah, it was really cool to learn about and see, especially being, in the marketing comms department and having such an appreciation for the design and the branding behind an organization. So to kind of get in the mindset of what the people working for PwC at the time had in mind around these different designs is really inspiring and beautiful. And it just kind of shows all of the different kind of evolutions and changes the organization has gone through over time. So yeah, please enjoy that blog article. It really does give some great insight into the past.
Yeah, thank you for putting that together. Our spotlight on hope this week, I wrote it about Freya. It was another, it's kind of a recurring theme this time of the year because her class, in middle school, they go on these big backpacking adventures. And so we went on another backpacking adventure and we went to the Trinity Alps, which is a mountain range in Northern California. That's where we've been going the last few years. And there were fires popping up around,
Mm.
which is always a little concerning, but none of them were super close. So it felt safe enough for everybody else. I, of course, was a little nervous. But when we turned on the back road, which was like 11 miles, 40-minute drive, that's the kind of back road, it started raining and raining heavily. And so I was like, yes, okay, I can hike and camp in the rain, no big deal. And then we got out and
Better
we
than fires. Yeah.
better than yeah, I was like, "Oh, we can take rain over fires
Yeah.
any day." And we got out, we put our pack on, Freya's got her big old pack, and we got to the trailhead and we started hiking in. Of course, the rest of the class is, like, far ahead of us. It's 9 athletic 13-year-old boys, and so they're a little faster than we are. And then about a mile in, the skies opened up, thunder, lightning, hail.
Mm.
Freya was very scared, and I was also scared. But she kept pushing through. She didn't like stop and say, I'm not going any further, or, she just kept pushing forward. At one point, she did say, we're going to die out here.
Oh, oh, Freya.
I can laugh about it now, but in the moment, I was kind of like, yeah, we might, but we're not going to.
Yeah.
And then at one point,
So funny.
this made me laugh. Not in the moment again, but at one point she did stop and she was like, I need a snack to go further. Cause like
In
on
the
these
middle
back
of this
in the middle of this, I was like, this is not snack
storm.
weather. I need you to keep
Mhm.
walking, please. But we got to our campsite. We were all soaked and cold. We got a fire but Freya just did great. And well, like towards the end of the hike, when we were close to the campsite, we didn't realize we were close, but she started singing to herself. She told me, she was like, do you know why I'm singing? It's like, why? She was like,
Oh,
it's calming me. And so, I don't know if it was like a
it's
slight
amazing.
against me. She was like, you're not calming me. So I'm going to
Oh,
sing to
yeah,
myself.
that's what it sounds like to me.
Yeah.
She need to do
You're
that
not doing your
now.
job. But, I thought that was really cool that she did that, and then, it was a
Mhm.
challenging trip in some ways, but she was a trooper, and she just kept,
Mhm.
everywhere her class went, she went, except we did not go to the top of the mountain. We were close,
Okay.
but it was, like, all boulders and climbing, and they didn't go till, like, the afternoon, and Freya cried, actually. She was like, "This is breaking my streak of climbing mountains," but it was a different kind of like, the other mountains we'd climbed up, there were trails. And this was, like,
Yeah,
not a
this is
trail,
like
it was, like, climbing over boulders, and we had already had to climb over a big boulder field to get to this lake we were hanging out, and she was already kinda stumbling a little bit, and so I had to make a decision that she wasn't happy with, but I assured her that we'll go back another time as
oh, that's great.
but, like, with people who are slower and
Mm.
do have more time,
Yeah,
and we'll start earlier in the day, but, yeah, she really wanted to get to the top of that mountain. She
mm,
was so determined, like, she knows she
that's
can do it,
amazing.
and I know she can do it too, but sometimes we just need a little more time, and we have to put our safety first. And when
Good
we
mom.
were
Yeah.
hiking out 4 days later, we were singing. I was singing to keep the bears away, or just to let them know we were coming through.
Oh,
I didn't tell Freya that. I was
this
just
does not sound like something I could do, Annie, so I'm so proud of you and Freya, oh my gosh. There's
yeah, you just
bears
let them.
involved on
There's
top of
bears, but, like,
farms,
they're not,
camping in general. Can't do it.
I wasn't worried about you don't have to worry about the bears, like, attacking you, you just gotta let them know you're there. So we were singing, and it was beautiful, and we were just talking about how courageous we had been on our way in and how
Yeah,
good it felt to be brave, and anyway, that was our camping trip, and she did great, and it's just she continues to amaze me with her determination and her abilities,
yeah.
so that was my spotlight, and, that is not on the website. You'll just have to if you wanna read that and look at pictures, you'll have to scroll through our social media to see that. So that's
Yeah,
it.
in the pictures, you can see the boulders Annie's referring to, and they are treacherous. Like, I could not do that. My family actually would go to a lake that had similar boulders when I was growing up. I did not climb one. I was like, "Nope, not for me." My siblings were like little monkeys running up, and I stayed at the bottom every time. So,
It's
yeah,
a
you
lot of
guys
work.
are
It was a
yeah,
lot of work.
that's difficult. I'm so proud. Go Freya.
Yeah.
Okay, moving on now to events and fundraisers. Of course, we want to start here with our Journey of Hope Gala. It is coming up in just a couple weeks, and we're so excited for it. We're so excited to really celebrate 50 years and this
Yeah.
amazing milestone that the organization has seen come to fruition. So I've said it so many times, but I'm really proud and honored to be here during such a monumentous time in the organization's history. So with that being said, the gala is taking place on Friday, September 26th at the Ritz-Carlton in St. Louis, Missouri, and really just putting a call out there to not miss this unforgettable evening if you can get yourself there. It's going to be an amazing night. So many wonderful people throughout, our entire history are going to be there, from early families to families today, to supporters, to extended family and friends. And I know that there's a very special person coming, and I really wanna say it, but I'm not going to. We'll share it after if we can. It's someone connected to the community, but I don't wanna give spoilers for our guests. I will share more details after the event, but to keep just a little mystery
Nice.
for our guests.
Love it. And if you wanna
So
find out
the
before then, get you a ticket and show up.
Get yourself a ticket. Yes, a perfect reason to come to find out. So, the registration deadline is Friday, September 19th. So, the week before the event. And you can get your tickets by going to the link in our show notes, Journey of Hope Gala. You'll find it there. And if you can't attend in person, you can still be part of the milestone by making a tax deductible donation in honor or memory of a loved one. And we'll have the donation link as a separate link as well in the show notes. We also want to make sure that the community knows that our virtual silent auction will be live soon, and it will be open to the public. So that means anyone, anywhere can bid on our auction items. There's actually going to be more than 35 auction items. So it's going to be
That's
a lot
awesome.
of great stuff. Yeah.
Yeah.
And appreciate everybody who, donated items, who made us aware of items, and great stuff. I'm just excited for everyone to see it. And then finally, I do have a hotel update to share. Our discounted room block at the Ritz-Carlton, which again is where the event is taking place, is now full. So if you'd like to stay on site, you can call the hotel directly. The phone number is 314-863-6300. Or you can go to the Ritz-Carlton St. Louis's website and book just online at the standard rate. And there's also actually a list of alternative hotel options in the Clayton, St. Louis area. And we'll have a link to that in the show notes as well, if there's another hotel nearby that you're able to stay at. But ultimately, we just can't wait to get together with everyone and honor 50 years of progress of PWSA. We've also been doing, Annie, a great spotlight series on our 12 awesome honorees,
Mhm.
our Pioneer Award honorees. And we had a couple more that we shared in this pulse, but we actually have all 12 now on our blog. So I just recommend going to PWSA's blog and scrolling the first page. I think they're all just still on the first page, and reading through them there, because you'll really get to know some incredible people who did so much early on and still do so much for the community to this day. And yeah, we're excited to recognize these amazing people at this event. So
That's so
check
special
it
to
out.
be able to look back at all the people that have had such a profound effect on this organization, on this community, and then to
Mhm.
be able to have this space where you can honor them. And yeah, what a beautiful, beautiful thing. Thanks for
I
putting all
know.
those together.
Oh yeah, it was so much fun to learn about all these people, and I got to work with the always wonderful volunteer Julie Doherty on these, and she was such a big help on them as well. So I want to make sure she gets a shout out too. But and then going through all the historic photos, I think I've scanned 150 printed
Wow.
photos into digital version at this point. And it was really fun to go through and see all of the, like, parties and, like, conga lines and
Oh.
different speakers at, like, the 1984 conference, it's really cool to see the history in that way. I'm such a sucker for photos. I'm very nostalgic just as a person. So yeah, it really struck me. But I had so much fun doing it. So go and check out the blogs for some of the pictures. And then I'm gonna actually try to put together a photo gallery somewhere accessible that people can go look at all of these historic photos too, because they really are really cool. And then right before we end here on Gala, I want to give a shout out to our amazing sponsors, our legacy sponsors, Soleno Therapeutics and the Seminole Hard Rock Hotel and Casino in Hollywood, Florida. And then our pioneer sponsors, Five Brothers Produce and Acadia Pharmaceuticals. We could not put this event on without these amazing sponsors and all of our other sponsors for this event. Thank you so much. Moving on now to our next event coming up. It's called Cocktails for a Cause, and it's taking place on October 18th at 6:30 p.m. Eastern at the Browns Brewing Company Malt Room in Troy, New York. Join PWSA USA's CEO Stacey Ward and her family for an unforgettable evening of support, hope, and community. Hosted at the scenic and historic Browns Brewing Company Malt Room, this event will bring together families, friends, and supporters for an inspiring evening of cocktails, conversation, and compassion, all aimed at raising awareness and funds for Prader-Willi syndrome. Guests will enjoy signature cocktails, delicious hors d'oeuvres, and the unique ambiance of the malt room, known for its charm and exceptional service. The night will feature engaging speakers, including families impacted by PWS, as well as opportunities to learn more about the syndrome and how funds raised will directly benefit those affected by it. The event will also offer a raffle, silent auction, and other interactive ways to contribute to this important cause. And we'll have a link to the Cocktails for a Cause registration page in our show notes. And another big shout out to these sponsors. We have Acadia Pharmaceutical as the gold sponsor, Soleno Therapeutics as the platinum sponsor, and then Catholic Charities as the silver sponsor.
All right. Well, we're going to move on to advocacy with a call to action for PWS families in 3 different states. So we've been putting these calls out there, and we will continue to put these calls out there for caregivers to submit written testimony for the pharmacy and therapeutics committees and DUR boards, which is drug utilization review boards. So these are all for each state. This is in regards to VICAT XR. They need testimony about your experiences with hyperphagia and PWS, and we're just really trying to get a push to get VICAT accessible in every state. So just make sure that you are paying attention to our socials so you can see when your state comes up. This one we have coming up, we have 3. We have both Minnesota and Montana coming up September 17th, and then Alaska, the meeting is coming up September 19th. So those are the days of the meetings. So in most cases, you need to get the written testimony in at least a few days, if not a little bit before that. So make sure that you're
Right.
checking those links now. Don't wait. But you can check out the links in the blog to learn more about it, and then we'll put some more information out coming soon just to make sure we really clarify what it is that these DUR boards are doing. So check those out. We also have this beautiful story submitted by Sarah Kasabi, one of our beloved staff members. Sarah said, "This past weekend, I had the opportunity to attend a powerful panel on mental health hosted by Femi's Heart Foundation. I was honored to speak about the importance of support groups and the vital role they play for families and individuals navigating challenges, especially in the world of special needs. In many of our cultures, there is still a deep taboo around both mental health and special needs. This silence often prevents families from seeking early intervention or accessing the resources that can truly transform lives. Without these supports, individuals are left without the tools they deserve to thrive. Breaking the cycle begins with open conversations, awareness, and compassionate community support. The story of Femi's Heart Foundation itself is an inspiring reminder of resilience and hope. Femi was only 10 years old when she received a heart transplant. Doctors said she wouldn't survive, but she proved them wrong, living 5 more beautiful years. After her passing, her mother channeled her grief into purpose by creating this foundation to help others, honor Femi's memory, and share her story of courage. Her legacy continues to inspire, and this panel was a reminder that through storytelling, breaking taboos, and building community, we can bring light and resources to those who need them most. So, Sarah, thank you so much for doing that work and for sharing your story with us.
Yeah, that's really beautiful. I'm glad that there's organizations that really do open that conversation up and make sure that all stories are told. Everyone has a safe space to kind of, like Sarah said, kind of break that barrier. I hope that it happens more. Like I think that needs to happen more. So yeah, big thanks to Sarah there. Okay, moving on now to our family support section. We start with a great blog that Annie pulled together from different grandparent perspectives, which is always an important perspective, especially in this community. So, Grandparents' Day was actually on September 7th, this past weekend. And in preparation for Grandparents' Day, we reached out to our community of grandparents to learn more about their experiences, joys, and advice. We invited them to respond to prompts on how they support parents, spend time with their loved ones with PWS, what brings them joy as a grandparent, and any advice that they may have for other grandparents. Some shared how they're able to help in day-to-day tasks, and others who don't live in the same area shared how they enjoy their visits and offer support from afar. To all of our grandparents, especially around Grandparents' Day, but always, we thank you for your love, your compassion, your support, and for continuing to show up in our lives. Our lives are better because you're here. And we encourage you to read all of these amazing perspectives submitted at the link in our show notes. Moving on now, PWSA is recruiting residential homes or programs to help pilot a new PWS residential training program. We are inviting residential administration, managers, and staff to take part in the PWS Home Base Pilot Program, a new multi-tiered support model designed to strengthen training, improve positive behavior supports, and provide resources to reduce stress and burnout among caregivers working with adults with PWS. Some of the benefits of participating include free access to structured training and resources tailored for residential programs serving individuals with PWS for 12 months, potential improvements in skills, support systems, and overall quality of life for residents. So, who can participate in this? Program administrators or residential managers who fit this criteria are 18 years or older, supervise at least 2 residential staff members, work in a program serving at least 1 adult with PWS, and speak and read fluent English. This is also for residential staff who are 18 years or older, work in a program serving at least 1 adult with PWS, and speak and read fluent English. If you're interested, you can contact our CEO, Stacey Ward, at sward, W-A-R-D, at pwsausa.org. And our Ask Nurse Lynn of the week. This question was submitted by a male living with PWS who is 23 years old and has an unknown subtype. The question is, I have PWS. I'm 23 and 5'7". I do not have diabetes, but my grandfather and dad do. I was wondering what my blood sugar should be every day. I just got a glucose monitor, so I want to make sure I'm doing good. I do work out every single day in the gym with my trainer and also do additional cardio. I weigh right now in the 150s. If you can let me know, I would appreciate it. Thank you. So polite. I love it. And you can read Nurse Lynn's response at the link in our show notes. And I'm so glad, Annie, that individuals living with PWS are asking questions, submitting questions. I think we see quite a bit of them. And if anyone out there listening has a non-emergency medical question about Prader-Willi syndrome or have a non-urgent medical question that keeps coming up, but you forget to ask when you're at the doctor, you can submit the question to our Ask Nurse Lynn form, and we will have a link to that in the show notes as well.
So under research, we have a new resource. This is a VICAT XR FAQ document. So I think most of you know, but if not, in March of 2025, the FDA approved VICAT XR, the first ever treatment for hyperphagia, which is that excessive hunger in PWS. Since then, families and caregivers have had many important questions about this new option. So to help with this, PWSA in collaboration with our clinical and scientific advisory board, has created a comprehensive FAQ document that addresses the most common questions and concerns. For those wondering, if anybody's wondering, unless I was the last person to know, when you see FAQ, I thought it was like a silly way to write like facts, but it actually stands for frequently asked
Frequently asked
questions.
questions.
I just learned that. Like, I think,
Just as an aside. Oh,
yeah.
you're so funny.
Anyway, so topics covered include indication and hyperphagia, effectiveness and monitoring, side effects and safety, interactions and pharmacology, diet and lifestyle, administration and dosing, and storage and pharmacy. We will have a link to this FAQ document in the show notes. So if you want to check that out, look for that link. If you want to learn more about ViCat XR, you can visit www.vicatxr.com. And we also want to say that this resource was developed with support from a grant provided by Soleno Therapeutics.
To the entire Prader-Willi syndrome community, thank you. Your strength, advocacy, and unwavering support helped to make the approval of ViCat XR possible. We're honored to stand with you in this journey and committed to continuing the work together. ViCat XR, diazoxide choline extended-release tablets, is the first and only FDA-approved prescription medicine for hyperphagia in adults and children 4 years of age and older with Prader-Willi syndrome, PWS. Common side effects include increased hair growth all over the body, fluid overload, high blood sugar, and rash. If you want to learn more about ViCat XR, please talk to your doctor or visit vicatxr.com.
So we also have social skills and PWS research study. And the purpose of this study is to learn about the perspectives of caregivers on social skills, challenges, and strengths in children with Prader-Willi syndrome. And this is coming from the Chicago School. This is just what you'll do. You will complete a short online survey via Question Pro, which will take about 15 and 20 minutes. And then you will have the option to participate in a follow-up Zoom or phone interview, which is 30 to 45 minutes. And participants who complete the survey will be entered into a raffle for a $50 Amazon gift card. To participate, you must be at least 18 years of age, have a child with PWS between the ages of 2 and 15, speak and read English, and have access to the internet and an internet-connected device. If you are interested, you can contact Kelly Krakowski, and I will have her email in the show notes. And I will also have a link to learn more about the survey if you're interested. You might remember that recently we had a webinar opportunity with Harmony Biosciences for their at-home Tempo PWS study. If you missed that webinar, here is your opportunity to watch it on our YouTube channel. And the Tempo PWS, that is the pitolisant, a potential treatment for excessive daytime sleepiness in individuals age 6 and older with PWS. This is the clinical trial that my daughter Freya is in. She's been in it for almost a year, and I am very grateful that we got into the study. So if you want to learn more about the study, you can go to tempopwsstudy.com, and we will also have a link to watch that webinar in our show notes. Continuing on with clinical trials, Aardvark Therapeutics Hero Phase 3 trial is enrolling. We have a new site. This site is in Gainesville, Florida, and will be operated through Dr. Jennifer Miller at the University of Florida Shands Children's Hospital. And Hero is this is a study, a global phase 3 clinical trial investigating ARD-101, which is an innovative orally administered treatment designed to help reduce hyperphagia and food-seeking behaviors in individuals. This randomized, double-blind, placebo-controlled trial is an important step toward identifying a potential new treatment option for the PWS community, and there are trial sites opening up all across the United States. So we will have a link to this in the show notes, to the blog that we have that lists all of the trial sites if you are interested in looking into that. And we have an exciting addition. We have Recursos en Español. I don't know if I said that right, but we have resources in Spanish. Thank you, Aardvark Therapeutics. They have 3 documents in Spanish, and if you want to check those out, we will have a link to those in the show notes. And
I love that they did that.
Really
Yeah.
cool, and we hope to continue to see more of that.
And finally, to end here, we have a resource spotlight to share. And this one focuses on our sleep summit that we held a few years ago. Sleep disorders are a common occurrence in the PWS community. Disordered sleep issues like sleep apnea, cataplexy, narcolepsy, and excessive daytime sleepiness can have profound and lasting effects on our loved ones with PWS. It is important for caregivers to learn more about these issues, to recognize the signs, and then bring any concerns to medical professionals in charge of your loved one's care. PWSA USA offers an incredible webpage dedicated to resources for sleep issues, and there you will find webinar session recordings, presentations, and downloadable PDFs as well. We will have a link to this valuable resource in our show notes, and I remember just how successful this was, Annie, way back when. I think we did it in 2022, but this was an incredible resource to put out. And I think we will continue to do more sleep stuff, as more resources are created, more studies are done. And we have a lot of great medical professionals in the field who are studying, sleep issues in PWS. So we'll continue to bring them on into the space as much as we can to help our loved ones and families. So keep checking back.
Well, Carrie, is there anything? Do you have any words of comfort for us before you leave us for 2 weeks?
I have every knowledge and awareness that it's all going to go very smooth, and yeah, it's going to be great.
It's gonna be great. I don't want you to have any fears. So sorry.
No, I definitely don't. I think my biggest fear is how horrible I'm going to be at communicating at the gala because I'm still experiencing some jet lag. So again, I think I mentioned it in the last episode, but I just want to reiterate, if you see me there and you're talking to me and I'm just like mumbling
Glazed
or blabbering on,
drooling at the corner of your mouth.
drooling, I'm going to be potentially sleeping, potentially overtired, and just like running a mile a minute. That's typically my MO there, but
I will be of no help because I will be on another backpacking trip
right.
to another
But
forest
again,
with bears and mountain lions.
regular. Oh my gosh, Annie. Keep putting yourself in front of bears. It's amazing.
Oh,
But we will be back to our normal selves, normal schedule in October. So thank you for bearing with us as we're going through some travel time in
yeah,
September.
all good stuff.
Yeah.
Well, and I guess I'll just say, maybe to close it out, I don't know if this seems random, but because I'm about to get on a doctor's appointment for Freya, and we're going to discuss whether we can up her growth hormone and her estrogen, and just thinking about the clinical trials and all the stuff that's happening with BiCat XR. It's just incredible the amount of options and treatment options and interventions that are out there and that we're learning about and fighting for to help our loved ones live better, fuller, healthier lives. I'm like, I got a little choked up there for a second. Sorry. But I'm just grateful.
It's emotional.
Yeah. So, once again, I'm just grateful for all of the people who have participated in clinical trials in the past, who are participating now. Grateful for all of you. So, thanks for that.
Thank you for listening to this episode of PWS United. If you want to learn more about Prader-Willi syndrome and how PWSA USA is making strides in advocacy, family support, and research, visit www.pwsausa.org. And while you're there, we encourage you to sign up for our Pulse email newsletter to stay informed about the latest news, resources, and events. Don't forget to subscribe to the PWS United podcast so you never miss an episode. Our team is always available to support families and their loved ones living with PWS 24 hours a day, 365 days a year. You can call us at 941-312-0400 or email info@pwsausa.org. Catch a new episode next Tuesday, and until then, have a great week.